Hi, my name is Dr. Iraj Kasimi from Hillcrest Dental, and I'll be answering some questions that we've gotten in regards to dental exams. Dental exams and cleanings are essential because if we don't see you regularly, there's a chance that a small problem can turn into a huge problem without you even knowing. Teeth have a very late warning system. Typically, there's no pain or anything involved until very late in the cycle of a cavity. So it's very important to see you every 6 months to, take a look at that tooth, take an x-ray if it's necessary. We like to take x-rays at least every year, but preferably every 6 months, just to ensure there's no disease processes that are happening that we can go ahead and take care of when they're small, because that's when it's going to be the least costly and the least invasive to treat. Dental exam will typically include at least one x-ray if we're doing a limited exam and focusing on a specific problem area, and a panoramic or a 3D CBCT x-ray. If it's just a full exam and cleaning, we'll get your full mouth series of x-rays, and then doctor will also come in and take a look. Our team is also very highly trained to take some great photos and explain to you what they're seeing, so that before the doctor comes in, you already have some idea of what's going on. And then typically we will also do a cleaning that day if time allows. So a dentist is looking for, first of all, are there any cavities, of course, but we're also looking at the bite. How's the occlusion or bite? Because that's a huge indicator for how healthy that tooth or your mouth is going to be long term. If your bite is bad, if your teeth are crowded or crooked or hitting in the wrong spots, they're getting a lot of damage. We really like to align the bite and restore the bite first. So we're looking at the bite, we're looking for cavities. We're also looking at the gums. So how's the gum disease looking? Is there gum disease? How's the bone support and the gum health doing? And then the last thing would be cosmetic. Are you happy with your smile? Do you love how your teeth look? Do you want to make changes? Do you want to do some whitening or some veneers? There's some various things that we look at. So it's the bite, it's cavities, it's the gum health, and then it's the cosmetics. Some of the recommendations that may come from a dental exam would include, do we first of all need any fillings? What type of cleaning is necessary? Is a basic cleaning going to work, or do we need a gum infection therapy, or SRP as we call it? Do we need to look at aligning the bite and restoring your bite into a healthier position? Some cases require a full mouth reconstruction if there's a lot of damage going on and the teeth are getting ground down. We also look at, are there any disease processes? Is there any potential cancers or anything like that even going on where we need to refer you out for a biopsy? So we look at the whole gamut. We do head and neck exam and oral cancer screening complimentary at every comp exam, just to make sure there's no, pathologies or diseases going on in your mouth that would require medical intervention. So we look at the full gamut. We even can offer a sleep study if you look like you have signs of snoring or sleep apnea going on. Full exam, typically if you're a new patient, comprehensive exam is scheduled with our hygienist, and it's scheduled for about 90 minutes. Sometimes it can take up to 2 hours if there's a lot of questions and a lot of details to go through, and that would include the time for the cleaning. If it's a limited exam, we typically schedule that for about 40 minutes to an hour. And then, of course, if we do start treatment same day, then you'll be hanging out with us longer to do the treatment, or we can schedule you back a different day if necessary. Dental exams are not painful. We just taking pictures, we're taking a look, drying the teeth a little bit and explain to you what's going on. Now, if you are in pain before you come in, then we can give you some medicine, some local anesthetic to numb the area so there's no discomfort while we're doing your exam. The best way to schedule a dental exam would be to reach out to us. Go to our website at hillcrestdentallv.com. You can also text our office or call us at 702-395-1088, or you can schedule online at our website as well.